Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Dina Hinshaw, Chief Medical Officer of Health for the province. Also with us is Paul Winnick, Deputy Minister and Chair of the COVID-19 Vaccine Task Force. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Before I provide our daily update, I want to address some of the many questions we have received from people who live alone about who they may gather with. I recognize the impacts that isolation may have on both emotional and mental health. That's why people who live alone are allowed to socialize indoors with 2 close contacts, as long as they are the same 2 contacts for the duration of the restrictions. To clarify, we consider you to be living alone if you are the sole occupant of your house, apartment, or unit. If you have a roommate, tenant, or friend staying in the same dwelling, you do not live alone. If you do live alone, the 2 contacts you choose do not need to be from the same household. They also do not need to be living on their own. But if you choose a close contact who has other individuals living in their home, indoor gatherings must take place in your home to limit person-to-person contact. I know it can be challenging to choose only 2 people, so I would like to thank Albertans in this situation for being flexible and doing their part to bend the curve. Turning to today's case numbers. Over the last 24 hours, we have identified 1,735 new cases of COVID-19 in Alberta and completed more than 20,300 tests. Our provincial positivity rate currently sits at about 8.5%, and we now have more than 20,000 active cases. There are 609 people in hospital, including 108 people who have been admitted into the ICU. Sadly, there were 16 deaths related to COVID-19 reported to us during the last 24 hours. My deepest condolences go to the family and friends of these individuals. The rising fatalities that we are reporting is a tragic reminder of the deadly power of this virus and why it is vital that we slow the spread. Sadly, 6 of the deaths we are reporting today are linked to the outbreak at the Edmonton Chinatown Care Centre. We are very concerned by the number of cases and the overall situation at the facility. Alberta Health Services has provided staff to help support residents and ensure they're getting the care they need. Alberta Health is also helping monitor the facility. Staff visited the site 3 times last week and again today. This is a challenging situation, but we are working hard to protect everyone involved. In schools, there are currently active alerts or outbreaks in 414 schools, or about 18% of schools in the province. Currently, these schools have a combined total of 1,644 active cases. This number includes 237 schools with outbreaks, including 106 currently on the watch list. Testing for COVID-19 continues to play an extremely important role in helping quickly identify the disease and prevent further spread. This week, we will begin piloting point-of-care rapid testing at the COVID-19 assessment centres in St. Paul and Slave Lake, and at 1 assessment centre each in Calgary and Edmonton. These tests will provide faster, more convenient testing for the disease. As I noted last week, these tests are used on patients who are within the first 7 days of showing symptoms, reducing the need for some patient samples to be transported to centralized public laboratories for processing. I need to remind everyone that in those without symptoms, the rapid tests are less accurate. In addition, they are less sensitive than the usual test, so those who have symptoms and test negative with the rapid test will still need to isolate while waiting for their results through the molecular lab testing. What this test does offer is faster identification of positive cases. Fast-tracking the testing process in this way will allow healthcare teams to prioritize the cases that are still infectious and focus efforts where they can have the greatest impact on preventing further transmission. AHS will be able to identify and notify positive cases within just a few hours, speeding up the appropriate care and isolation of patients. AHS and Alberta Precision Laboratories is also working on expanding the use of point-of-care testing in other locations, including long-term care facilities and shelters. The steadily rising COVID numbers in our province continue to be extremely troubling. I encourage Albertans to keep them in mind when considering how to best incorporate restrictions into their daily lives. The small changes that we all make have tremendous power. They stop the virus from spreading and break transmission chains, preventing dozens or even hundreds of cases that would have otherwise occurred. At the same time, the small bending of the rules, the one-time social get-togethers with extended family and parties with friends, have the power to undo the hard work of so many within just a few minutes. On Friday, I challenged everyone to limit their in-person interactions as much as possible over the weekend. I want to thank everyone who accepted this challenge. While it may have felt anticlimactic to stay at home, you did the right thing, and I thank every Albertan who has been working hard to stop the spread. The high case numbers we saw reported over the weekend and those reported today were from people who were largely exposed between a week to 10 days ago. However, the continued rise in new cases and hospitalizations underscores the seriousness of the situation we now face. I will be blunt. So far, we are not bending the curve back down. We are still witnessing very high transmission of the virus, which is putting enormous pressure on our hospitals, intensive care units, and healthcare workers. It is also putting tremendous strain on our continuing care facilities and many other sectors. Healthcare workers in hospitals and continuing care facilities, as well as those leading important public health work like contact tracing and outbreak management, have been on the front lines, working hard for many months. I know that many are exhausted. We must do all we can to protect them, especially during this period when COVID-19 is spreading rapidly and more patients are being admitted into hospital. My team and I are monitoring this situation very closely. We are now in the 9th month of this pandemic. I am more concerned than ever before about the spread of this virus. Every one of us needs to be a part of the response, and we need to come together to protect each other. Thank you, and I'm happy to take questions.
All right, we'll go to the phone now. Friendly reminder that in addition to Dr. Hinshaw, we also have Deputy Minister Winnick available for questions. Operator, could you put through the first caller, please?
First is Jeff Slack with 660 News. Go ahead, Jeff.
Hi there. I believe this question is for Minister Winnick. With the announcement of just about over 240,000 vaccines being provided to Canada, do you know how many that we're getting and who might be getting these first batch of doses?
So I'll maybe take the first crack at that and then pass it over to Deputy Minister Winnick. So we have been working, the federal government did give us some notice that we might be receiving early vaccines. And so we have been working to prepare. We do have one receiving site in Calgary and one receiving site in Edmonton. And we're working with the federal government to finalize the volumes of doses that we would see in those first two sites. What we know is that the vaccine that's delivered in these first shipments must be given to people at the same site that the delivery happens at. So those who will be eligible, again, have to come to those sites for vaccine. And so we are looking at the healthcare workers in shortest supply and where there is the greatest pressure on the system to make those doses eligible, those people eligible for the first doses. And more details will be coming very soon about how that will be rolled out. But I'll pass it over to Deputy Minister Winnick for any further information.
Thank you, Dr. Hinshaw. I don't really have a lot to add to that, but I do want to stress it's the job of the small team that we've assembled to actually make sure that we've got those plans in place. And I guess I want to assure you, after being on the job for about 4 days, we've had a chance to look at AHS's plans, and they've been working on this for months. I mean, we've got all the logistics in place. Really, all we're awaiting now are the details of the shipments, as Dr. Hinshaw has said. But when that vaccine gets here, we are ready to receive it, and we're ready to roll from that point on. Thank you.
Operator, could you put through the next caller, please?
Next is Robson Fletcher with CBC. Go ahead, Robson.
Hi, Dr. Hinshaw. This question was for you. So a few months ago, we were seeing about a dozen cases per week among Albertans aged 80 and over. Last week, we saw more than 400. And adjusted for population, this age group also has one of the highest rates of new cases recently. So I'm wondering two things. One, what do you think is driving this increase primarily? And two, given this age group is especially prone to severe outcomes, what does it mean for hospitalizations and deaths in the coming weeks here?
The number of cases in that older population is absolutely a concern. One of the reasons I anticipate we're seeing that increase is we have had more outbreaks lately in long-term care and designated supportive living facilities than we had previously been experiencing. And as I've said before, part of the challenge we experience is when we do have rising case numbers and rising transmission in the community, we see that increasing pressure on those long-term care and supportive living facilities, and it's very, very challenging to keep any introduction of virus out. I would anticipate, of course, that with rising numbers in that very vulnerable population, it may well be an indication of an increase in the most tragic outcome with respect to deaths. With respect to hospitalization, while, of course, many individuals in that age group, if they have chosen that as a part of their care plan and they need that care, will end up in hospital. I want to make very clear to Albertans that the people who need hospitalization when they are infected with COVID are a broad range of ages, and the average age of hospitalization is around the mid-60s. So while, of course, it is concerning to have this increase in the number of older Albertans who are being infected with COVID-19, it's also concerning to have any age group that's experiencing infection with COVID-19 because our hospitals have a wide range of ages in them, and those kinds of severe outcomes of ICU admission and hospitalization can happen in any age group.
Operator, could you put through the next question, please?
Next is Julia Wong with Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. You mentioned we aren't bending the curve back down and that there's high transmission of the virus. At what point do we stop waiting to see if the restrictions announced in late November are working, and at what point could new restrictions be announced?
My team has been working very hard to put together a package of recommendations for discussion. As you know, Cabinet makes the ultimate decisions about what restrictions will be put in place and what timing that is on what timing those are introduced. But again, my team has been working hard, and so we are concerned by these numbers, and we'll be bringing those recommendations forward.
Operator, could you put through the next caller, please?
Next is David Staples with the Edmonton Journal. Go ahead, David.
Hi, Dr. Hinshaw. I have two related questions about people in long-term care. A lot of them have been under lockdown for a long time now. What are the mental and physical implications of lockdown for the elderly people in those circumstances? What are you hearing and seeing about that? And in terms of vaccination, are they going to be able to get the first round? Because it sounded like they might not be able to move to the vaccination spot, so they might be excluded from that. So what is the plan with vaccinating those people?
The impact of this pandemic experience on seniors in those kinds of congregate facilities has been significant. As you know, in the summer, we did change our visitor policy so that we were allowing more people to have some contact with their family and friends, because we heard loud and clear that the impact of that universal visitor restriction was extremely difficult for residents in those facilities. And the evaluation that we have done to date shows that the visitor restrictions that are currently in place have not been a major driver in the outbreaks. I haven't seen the final numbers, but again, we aren't seeing that those visitor restrictions that we currently have in place are the main reason that we are seeing these outbreaks in the facilities. And we know that, for example, when we put in place our restrictions on group exercise or group recreation, we were very clear with the operators of continuing care facilities that those who all live in that same facility, when that facility does not have an outbreak or an exposure, that they can continue with group recreation, group exercise, because we know in elderly people, when they are not able to exercise or not able to move about, that can have impacts on their physical well-being very quickly, much more quickly than in people who are younger. So we're trying our best to make sure that the restrictions keep the people who live in those locations as safe as possible, while trying to allow them to do as much as they can within that balance of keeping them physically safe, but also wanting to support their mental and emotional well-being. With respect to vaccination, what we know right now is that the early doses that are going to be delivered in December, which is quite a small amount from what we understand at this point from the federal government, those are the doses that would need to be delivered to people at the site that the vaccine is delivered to. We aren't at this point clear on exactly how long that restriction will be in place for. And of course, we're planning to be able to bring vaccine to the locations of this high risk, so those in long-term care and designated supportive living, as soon as we're able to do so. And we're working with the government, the federal government, as well as the manufacturer to understand how quickly we will be able to initiate that part of the campaign.
Operator, can you put through the next caller, please?
Next is James Keller with the Globe and Mail. Go ahead, James.
Hi, Dr. Hinshaw. You've previously said that we would see 60% of the effects of new recommendations after about a week. The most substantial recommendation, this ban on social gatherings, was 13 days ago now. So do you see evidence that the recent restrictions are having any effect on infection rates? And if not, what does that tell you about how severe any additional measures will need to be?
The measures that were put in place, as you say, about 10 days to 2 weeks ago, obviously that the measures came into effect on 2 different days. The impacts that they have had already, again, we certainly have seen any early impact that was going to have. I believe that all of those restrictions have made us, have put us in a better position than we would have been had we not introduced those restrictions. However, it's currently looking like the measures that were put in place 2 weeks ago are unlikely to be sufficient to bend the curve downwards, which is, of course, what we have to do if we're going to protect our acute care system. And so the question about what may be required to actually do that is, again, one that we're discussing and that is a part of that package of recommendations that's being brought forward.
Operator, could you put through the next question, please?
Next is Matt Woodman with CTV Edmonton. Go ahead, Matt.
Hi, Dr. Hinshaw. I've got one quick question for you and then one longer one. My first quick one is, I'm just curious if you know the R value for Alberta and if possible Edmonton as well. My longer question is, we spoke with the former president of AHS, Stephen Duckett, and he's running Victoria's COVID response in Australia. And that state hasn't had a case in about 4 weeks now. And Duckett says basically you can't rely on people to self-isolate. You need to have a full lockdown in order to keep cases low. Do you agree with this approach, or do you feel you've lost the social license to do something similar here in Alberta?
With respect to the first question on R value, I don't have it in front of me, but we can follow up. This respect to the question about comparing our response to Australia, what we have been focused on in this province and in many other places around the world, in Western Europe and many other provinces in Canada, is trying to balance between the harms of COVID-19 and the harms of the restrictions. Unfortunately, we have seen the harms of COVID-19 start to tip that balance. And as you know, and as you're quoting in Australia, they have taken a different approach where they've focused on getting their cases down to zero. We are, again, working to put together that package of recommendations that we think will help us bend our curve downwards. We have not been driving to zero cases, as again, we need to be making sure that the restrictions that are put in place are going to be enough to bend the curve, but we also don't want to inflict any unnecessary problems with those restrictions, and that's that balance that, again, we've been striving to achieve for many months now. And there are pros and cons of different approaches. I've often said there's no one single right way to move through this pandemic, but of course we're looking to many international examples and trying to learn what is applicable to our own context and how best to address the situation in Alberta.
All right, we've got time for 3 more questions. Operator, could you put through the next caller, please?
Yes, one moment, please. Our next caller is Dean Bennett with the Canadian Press. Go ahead, Dean.
Thanks very much. Dr. Hinshaw, so essentially what's happened is the rules that you and the Premier rolled out 10 days ago aren't working. So the question is, what went wrong? Were the rules not strong enough? Were they strong enough and the people weren't following them? Or was it a bit of both? Also, as you bring in your new rules, I want to make sure you and the Premier, are you in agreement on the best way to focus on this? And by that I mean last Thursday you said rural cases are going up. COVID doesn't respect postal codes. It's a province-wide problem. 2 hours after that, the Premier said, no, it's a Calgary-Edmonton problem. And if we bring in harsher new rules, it's going to focus on those 2 cities.
Thank you for the questions. With respect to the question of what was the impact of the restrictions that went into place 2 weeks ago, as I said earlier, I believe that if we had not put those restrictions in place, we would be in a worse place now than we are. And so while they were not sufficient to bend the curve enough as we want it to come down, every time we avoid transmission, every time we avoid super spreader events, we are in a better place than we otherwise would have been. I think that there's always a combination of questions of the rules. Are the rules enough to bend the curve? And then that question of, are people actually following the rules that are there? I think that there's a mix of both. I think people are doing their best, but obviously there's also many who are very, very tired, and also many who may not have the resources. We're working hard to make sure that we're making the information about our current situation and the actions that need to be taken more accessible to people who may not have the same resources as others to be able to follow the restrictions that are in place. With respect to the rural versus urban, it's true that the cases and the case acceleration that we're seeing is across the province. For example, in Central Zone, we have the highest acceleration in case rates over the past couple of weeks of any zone across the province. It's also true that the majority of cases are in Edmonton and Calgary as the 2 major population centres. And so the question of what kinds of restrictions will be necessary to bring our curve back down, again, that's a question that will require a lot of discussion, because we know that COVID is a problem across the entire province. We also know that the biggest number of cases is in those urban centres, and so that's, again, a matter for debate about what set of measures will be sufficient from a provincial level to bring numbers down. But what I can tell you, and what is absolutely clear, is that COVID is not sparing parts of the province. And so the measures that are currently in place that are province-wide really do need to be respected and followed everywhere in the province.
Operator, could you put through the second last question, please?
This is Rick Bell with the Calgary Sun. Go ahead, Rick.
Good afternoon, Doctor. I'm just following a couple of the previous questioners. I just want to sharpen this question a little bit from your previous answers. Do you, as the chief public health doctor in Alberta, do you think a lockdown of some kind, whatever definitions may be out there, do you think a lockdown, as we've seen in many other places in Canada and around the world, is now necessary to keep the healthcare system functioning until we see the benefits of the vaccine? So what do you think? I know there's a suite of options for the Premier. We'll find out what the Premier thinks, but what do you think?
I think that the current measures that we have in place are not likely to be sufficient to bring down our numbers. So we will need, if the goal is to bring our numbers down, we will need additional measures to be able to do that. I think that the exact restrictions that are needed, that's where that question lies. But I do believe we do need additional restrictions in order to bring our case numbers down and protect our healthcare system.
Operator, could you put through the final question, please?
Final question is Elise Stolte with the Edmonton Journal. Go ahead, please.
Thanks. My question is in relation to the South Asian community. The Premier recently talked about an action plan to create isolation spaces with culturally appropriate food, but community members say they don't have any information on that. I'm wondering if you can give more details in terms of when this might be available, how people can access it, and how this is different from what's currently available.
First of all, we have had spaces available for anyone in the province who's either a close contact or a confirmed case and does not have the ability to safely isolate in their home. So we have had hotel spaces available since the spring for people in that situation. And when someone is identified as either a contact or a case, there is a question about whether or not they can safely isolate. And if they can't, they don't have the resources or the means to do so, then they are linked in with a referral to make sure that they know what options they have available to them. There's work going on to make sure that all those who might benefit from that resource, and so that's not just South Asian communities, but other communities who may need additional resources that they are people who might need them are linked up with the resources that they need. And the planning is underway to be able to provide that information. I don't have a firm timeline except to tell you that the situation, of course, is very urgent to be able to do everything we can. This is just one part of our broader response. And so I anticipate that more information will be available soon to all those who might benefit from additional supports.
Thank you all for joining us. Dr. Hinshaw will provide another update tomorrow afternoon. Have a safe night.